worked out in the community, working with people primarily with brain injury, but certainly with other neurological damage as well, for about 15 years. And at that point in time, I got quite frustrated with the mahi that I was doing, so I decided to go into research, and I thought that probably I could be more effective doing research in the area that I am interested in, and that is how neuropsychology impacts on Māori in this country. And as Elisa has already alluded to, there are lots of changes, or there's lots of progress to be made, not only for Māori, not only in terms of applying neuropsychological practices to Māori, but for the many other cultures that now reside in our country. But my interest, of course, is how it is applied to Māori. So neuropsychology is basically interested in the relationship between the brain and how that is manifested in the behaviour, whether it be emotional, actual behaviour or moods. And often us neuropsychologists are interested in what happens or how the behaviour is manifested after an injury or after there has been some sort of assault to the brain. It's a fascinating area of study. So a neuropsychological assessment is usually composed of 3 components. And so the first one is a review of your medical. So some of you people here would have had a neuropsych assessment. Some of you would have had more than one. Usually a neuropsych assessment, certainly after a traumatic brain injury, occurs around about 6 months after the head injury, typically. And this is when, lots of some natural recovery has taken place, things have settled down, and we can kind of get some sort of baseline of how you are functioning at that point. Depending on what happens with the individual, there can be repeat neuropsych assessments later on, usually at 6-monthly intervals for the first couple of years, and then at more longer intervals after the first couple of years. Sometimes some people don't get any more after, obviously, once they've plateaued or recovered, then neuropsych assessments will probably stop. So there are 3 components. We have a review of all the clinical records, and those of us that work primarily with ACC, we usually get a file, a big huge file that accompanies the client. So we get lots of other medical notes, as well as any notes from any physical examinations from the neurologist, so on and so forth. And we get information about the pre-morbid functioning, that is how the client or how the person functioned prior to the head injury or to the damage to the brain. That is really valuable information, because if we can look at and we can get a picture of how that person functioned prior to the brain injury, then and we look at them now and get some sort of evaluation of how they are now, then we can obviously see what's gone wrong and what interventions and where we need to step in and help that person rehabilitate. And so the third component is the administration of tests, and these are usually pencil and paper tests, and they cover all the various areas of cognitive thinking, cognitive functioning, which is just, cognitive is really just another word for how you're thinking. As Elisa already said, neuropsychologist is a person who's trained as a clinical psychologist, and they specialise in the area of neuropsychology. All up, we have about 9 years formal training, and a lot of that is actually out there in the real world doing actual assessments with people. So it's not all just learning, from a book in universities, but a lot of it is. So the people who suffer from a neurological trauma, these are all the people who may be subject to or may have to go through a neuropsych assessment. And this is not a complete list. There are lots of other medical conditions which arise where people are where cognitive thinking is compromised. So there are many other areas as well within the medical field where a neuropsych assessment might be useful. But yeah. So we have 2 types, well, we don't have 2 types, but you have neuropsych assessment for adults. So we have certain tests that are appropriate for testing intellectual capacity in adults, and of course of those tests we often have children's versions as well, which apply to children's versions. And the normative data that accompanies those tests, that is when the tests are developed, most of them are developed in the USA or in the UK, which is problematic for me as a Māori. Because what accompanies those tests is this normative data. So they apply those tests to a whole lot of healthy people in the USA, find out what their scores are, compose it all together or bring it all together and say this is normal. And then when they administer the test, if you don't fall within that area that is deemed to be normal, then obviously they think there's something abnormal. And because my argument is that what is normal for people in the USA or people in the UK is not normal, probably for most New Zealanders, but definitely not for most Māori. And so that's my area of interest. These tests that are administered pretty much in fact, indeed, reflect a Western worldview. Ignore a Māori worldview. There's nothing Māori, and there's nothing, in fact, there will be shortly, but up until now, traditionally, there hasn't in fact been any content within these tests that in fact reflect what we as New Zealanders know, let alone what Māori know. Referrals can come from a range of people. Primarily, most of the neuropsychologists in this country get their referrals through the ACC system, and there's lots of rules and regulations around ACC. One of the problems, and certainly with working with Māori anyway, but however, I think this should probably be pertinent to all cultures, is that, but working with Māori, you need that little bit of extra time, eh? You need to do whakanatangi, you need to, thank you, thank you. You need to do all the protocols that fit in with tikanga Māori, and so that takes time. And so we have a relationship with the people in ACC, and we argue all the time that, hey, when we're working with Māori clients, we need to have that extra time in order to incorporate those cultural aspects of the assessment. Because when you're going for a neuropsych assessment, it can be quite a daunting experience, and it's the skills of the neuropsychologist who should be brought into play to help you relax and perform at your very best. And so that's why neuropsychologists have to in this country have a background in clinical psychology, because we're meant to know and have all those skills about making people feel good. And so referrers for neuropsych assessment can come from all sorts of areas of our community, including Department of Justice, the Department of Education, SIFs and so on and so forth. So the social implications for many people are widespread, and particularly for Māori, because we are overrepresented in a lot of these areas. And so a lot of Māori don't understand the power that these neuropsych assessment reports can have. And so in a forensic setting, for example, the judge can often make a decision based on the neuropsych report as to the culpability of the person who's before him. So as I say, the implications for the social implications are very widespread. And also in the Ministry of Education, so lots of our children who come through SIFs or just come through special ed are given a neuropsych assessment, and depending on whether they have an intervention or input into their education from there on in, depends on what is the recommendations are made from the neuropsych report. So it can really be quite life-changing. So the purpose of a neuropsych assessment is to help a person make sense of their world, to be able to identify the strengths and weaknesses that person's actually experiencing in the world. And your job as a neuropsychologist is to help that person identify them and make their day-to-day activities easier, given the knowledge that that the neuropsychologist has gained throughout the assessment period. So it's so it also that information helps to plan, to manage, and to treat the client who's got the brain the brain injury or the trauma to the brain. Neuropsych assessment can also assist in making diagnosis, so often it's coupled together with other information from other specialists to help make it a determinant of a specific diagnosis. And as I said, it does provide a baseline so that reassessment over time can take place, and then they can sort of track if progress has been made or not. So depending on each individual, the neuropsych assessment can last from a minimum of 3 hours and 8 hours or more it can go for. When it starts getting to that long, it's your call. You can ask to have it over two days. Over 2 different sessions, because fatigue sets in. Lots of us with brain injury suffer fatigue, so it is your right to ask to have it done over more than 1 session. In terms of therapy that I've done with clients, I almost, and most of them do have fatigue problems. 11 o'clock, I get them to take their rest. You always try and preempt fatigue. You always try and get the client to take the rest before they get too tired, because then it's much harder to come up. So before they get, as I said, around about 11 o'clock, after they've been up for 2 or 3 hours, is probably a good time for most of us to take a rest, and then you kind of set you up for the rest of the afternoon. So why do we have a neuropsych assessment? And these are the reasons why there is a bit of a bad profile, I think, with neuropsychologists out there, to be honest. But, I am involved with them when they come through in training, and generally they're pretty good people, and most of them do mean well. And this is what we want to help, clients do. We want to help them return back to work or to school. We want to find out, do they need a return to work program or return to a school program, and what is that going to look like? Is that a gradual process? Or, do you need help? Does little Johnny need some teacher assistance or teacher aid in there to help him get back and catch up with the rest of the class, and so on and so forth. A lot of people want to know, when can I start driving again? And that's a major one, and usually the neuropsychologist can make some sort of recommendations about that, but that often is made, I think the decision is made by the GP or the vocational people, OTs who do driver assessments. And so these are the areas that will be assessed within the areas of your thinking that will be assessed in a neuropsych assessment. So your learning and memory processes, your attention and processes, which as Elisa said, are very important, because they are like they're a precursor to memory. If you don't attend to something, you're never going to be able to remember it. So that's kind of where the memory process starts. Any sensorimotor functions, visual spatial, that is how the relationship or how you relate to objects in the world. My spatial relationships were quite challenged getting here today, because I didn't, thank goodness for coloured balloons, but and it's really interesting. So some people retain those types of thinking skills, so and that means, oh good, so you can actually use that to help people who maybe not be so strong with verbal skills. And so if there's a child who has to go back to school, you can have a word with a teacher or the teacher aide and say, look, little Johnny's going to be able to learn better if you draw diagrams, if you present pictures, and then that's going to be that way. That's how assessing these thinking abilities can help out in the real world. So executive functioning is about problem solving, so that's working through a problem to reach a resolution at the other end. Planning and abstract thinking, so for example, I might ask you, I'll just give you an example because otherwise it sounds like just a whole lot of words. Abstract thinking, I might ask you to think of 2 different words, some of you will recognise this, and tell me how those 2 words relate to each other. And so that's asking you to think beyond the concrete, behind the tangible and immediate, and think abstractly. And so that particular test gets more and more difficult. So that's one of the areas that is involved in executive functioning. Executive functioning primarily is mediated in the frontal lobes, and a lot of us, that means that's where it's organised or managed in the frontal lobes. So, and a lot of people do have executive functioning problems because often that's part of the brain that is injured. Executive functioning also can tell us how flexible you are in your thinking. So some people can't move, they get stuck in one particular mindset, but it's very important that we are able to be flexible with our thinking, and we can move from one mindset to another, so we can test for stuff like that. And so if you're driving along the road and for example, okay, so if you're driving along the road and you come up to a roundabout and you have to go like over that way around the roundabout, well, quite a lot of different types of cognitive functioning or thinking comes into play. So you've not only got to be able to get all this information, okay, you want to turn right, it's the third turn off ramp around the roundabout, you've got to watch for any traffic that's already on the roundabout, you've got to give way to traffic on your right side. All that information you've got to be able to hold in your head and actually make and then act on it safely. And so that's why, in that way we like to find out how well you are functioning, so that in that particular case, are you safe to drive? So I guess what I'm talking about here is how do these, testing these skills, how does that actually, pan out in the real world? And that in our terms called ecological validity. So what that means is what does this actually mean in a person's life? And, how can we sort of work on those problems or strengths in order to facilitate their recovery or their rehabilitation. Visual spatial skills, that's, as I said before, is your relationship with objects and space in the world, and very important and a crucial part of our thinking. You wouldn't like a surgeon to be there with a scalpel and you've got an artery there, and he's going to, you need to know about spatial stuff and many different vocations. And memory will check for your visual memory and your verbal memory as well. And so we know that, and Richard has already talked about different areas of the brain that control various thinking abilities to think generally. Some of them kind of cross over, but often this helps in diagnosis and so on. But you don't really probably need to know about that too much. Why is a neuropsychologist asking about my moods? So lots of people, after they experience a traumatic brain injury, have mood changes, and some of you might experience this yourself or with the member of your whānau. So what the neuropsychologist will do is administer some psychological measures about your mood, and then if they think it's required, then they will suggest maybe counselling might be needed for you and your whānau member. People with TBI, the number, like as I said, I've worked with many over the years, and generally a lot of them do have problems with tolerance, tolerating noise, tolerating sound noise, light. They have low tolerance to this, and so we need to be able to identify that and accommodate that. Okay. So a neuropsych assessment. So preparing for the assessment, this is the slide I think that is probably the most important. It's really important that you do get a good night's sleep, because you fellas know it can be really taxing work. It can really take it out of you. So as I said before, we want to find out the best that you can perform, so that we know what you are capable of doing under ideal circumstances. True, when you go out in the real world, it's far from ideal. You've got noise, you've got people, you've got all the rest of it going on, all the stresses of everyday life. But we want to know what you can do under ideal conditions, so that you can strive to achieve those types of that profile that you've shown us in the assessment setting. So make sure you have a meal beforehand, because you're going to be quite a long time without a kai. I talk to the neuropsychologist trainees at the university, and I say that they should be offering kai. And for me, with Māori clients, even if it's a cup of tea and a biscuit, in line with tikanga Māori. Decide who you want to take with you. So you might want to take a whānau member or a friend. It's probably best for you not to take too many people because you don't want to be, sidetracked by all the other clutter in the room sort of thing. Not that your whānau's clutter, but you know what I mean. It's really important to organise transport. It's amazing the number, and because a lot of people with TBI, and I am talking mainly about TBI now, don't have good planning skills and they might get there late, and the neuropsychologist is a little bit frustrated because they have got a timetable to stick to. So make sure you organise that well, even if you do it through your ACC case manager, if you're involved with them, or one of the other OTs or other allied health people that you might be working with. Take all relevant documentation. This is really important because I think what the problem is, one of the problems with the neuropsych assessment is that it's just a snapshot of yourself. And so the neuropsychologist is not going to remember, they're usually there taking notes, but may not remember everything that's been said. It's important for you or the person with you to actually take that information in there, all written out clearly, and leave it with a neuropsychologist. And that will help make this more relevant, make the assessment more relevant to your situation. Yeah, I can sign that. That's a really important one. Think about it. Some neuropsychologists send out a pre-assessment information sheet, and so you can put as much information on there as you can. That's going to be helpful, of course. Oh yeah, write down the history. So what the neuropsychologist will try and do is to establish what they call as your pre-morbid ability. How did you function prior to the assault on the brain? So that they can compare it to how you're functioning now. And so anything that you have that can help the neuropsychologist, figure that out will be really useful. So for lots of us, because we didn't go to, because we didn't get NCA 3, because we didn't go to university, because we don't have a job, that doesn't necessarily mean we're not intelligent. It could possibly mean we didn't do well in the education system because the education system failed me. I might have lived out in Timbuktu and there's no jobs there to be had. So, but what you should be doing is actually thinking about stuff that will highlight your skills and what you are able to do. What do you do on the marae? Lots of our people, well, I look at all the mahi that goes on the marae and all the organisation, all the skills, thinking skills that is behind all that. That sort of information is really useful in terms of determining what that person or was able to do. Now, who comes to mind immediately is my cousin who had a stroke actually about 3 years ago. Prior to that, she was, like we have on our marae, she was our queen. She told us and did everything and managed everything, and she was just amazing. And of course now she's absolutely on the periphery of anything that we do and is not able to be involved too much. But that kind of, but she was a housewife, she was a wife of a farmer. I guess she didn't really have any formal education, but she did have lots of skills in terms of management skills, in terms of what her role on our marae. So that kind of information is useful. A list of all your medications, because that will obviously give information or give background information to stuff like fatigue and how that impacts on how you perform during the day. And of course, don't forget to take your glasses or your hearing aids because you're probably going to be needing them. So as I said, it can take 3 to 8 hours or even more. So we've been through all the stuff. The third person, so there's lots of discussion amongst neuropsychologists. They don't like a third person being present in the room during the formal assessment. That's when we're actually giving the test, because they call it third-party observer effects, and they think that it's distracting and it doesn't allow you to perform as well as you could do if you were on your own. And ultimately, it's your decision to decide. You can demand that with a neuropsychologist, if you want your wife there or your husband there or your mother there or whatever, you can insist, because it is actually, at the end of the day, it is your decision to make around that issue. So Yeah, some people become very anxious around, with an upcoming neuropsych, but try not to. I know it's easy for me to say that, but the more you are able to relax, probably the better that you are going to perform. But however, the tests are designed to challenge you, so don't expect it to be an easy ride, because that's not the point of it. Some of the tests people find the test very interesting, and some people can become very frustrated and upset because it may be the first time that they're confronted with the fact that I can't do this any longer. This used to be a breeze to me, and that is often an occurrence, isn't it? And so it can be quite an emotional time for people. But the best, all I can say is try your best, and the skills of the neuropsychologist should come into play right throughout to help you, in fact, achieve your best. And so in terms of the report, it is always, if you've had an assessment through a neuropsychologist contracted to ACC, they are obliged to provide a follow-up assessment, and this is usually for an hour, and it just helps you to go through it, read through all the medical jargon, what does this mean, what does this actually mean, and go through the recommendations with you and your whānau, and clarify anything, of course, that is not clear to you. So in terms of people who get referred through insurance companies and so on and so forth, I'm not quite sure what their policy is, but yeah. And somebody asked me earlier who was entitled to read the report. Just you guys, just a few of you yourself, the referrer, and they do go on file. And so, talking about Te Whare Tapewha, yes, I think not only for Māori, but for everybody, a holistic approach is the way to go, and that's what I certainly talk to the students about. And that's looking at all those 4 dimensions, which I think is the road to well-being. But, I'd just like to say, I think that's the last one. Yeah, I'd just like to say, I have a lot of aroha for those of you who and your whānau who have suffered TBI, having worked in this field for many years, and hopefully that we can, as neuropsychologists, make it a better experience for you, and just help you on that road to recovery. But kia kaha, ngā mihi nui ki a koutou, kia ora.